Good evening. I'm Casey Leonard.
And I'm Nicole Bailey.
Today, Medical News USA, bringing you medical news every day and every way, is going to be doing an expose on Cushing's syndrome. What is the endocrine system, you ask?
How does it work, Casey?
Well, the endocrine system interacts with the nervous system to coordinate and integrate the activity of body cells.
The endocrine system does this by means of hormones, which are chemical messages released to your bloodstream.
These hormones are produced by endocrine glands, also known as ductless glands, which release hormones into surrounding tissue fluid. These glands include the adrenal, pineal, and thymus.
Additionally, some organs function as endocrine glands like the pancreas, ovaries, and testes, the hypothalamus. Furthermore, various other tissues and organs produce hormones. For example, the stomach, small intestine, kidneys, and heart all have cells that secrete hormones.
And why is it important, you ask, that this system functions correctly? Well, the endocrine system is crucial to our body's functioning. Along with the nervous system, it is one of the two systems that control the body.
The endocrine system controls and regulates energy, reproduction, immunity, behavior, and growth and development.
And now, a word from our sponsors.
Or steroids.
After steroids.
Steroids, the right choice.
Cushing's is a relatively rare disorder, affecting 10 to 15 million people a year.
Just tell me where to start.
Go.
This is what people think Cushing's syndrome is. Alright.
Hey Joe, what do you think Cushing's syndrome is?
What?
What do you think Cushing's syndrome is?
I don't know.
What do you think? Don't just mic. This is the mic.
It's a mic, okay.
Yeah, so what do you think Cushing's syndrome is?
I don't know.
Have you ever been affected by Cushing's syndrome?
No. Not that I know of.
What if somebody in this class obviously had Cushing's syndrome?
Okay, alright, let's go try to find someone else who knows what Cushing's
It does.
Good test it is.
It's our physiology project, I'm sorry.
I'm sorry. But I'm not at the same time, so. What do you think Cushing's syndrome is?
I don't have a clue what Cushing's syndrome is. I don't know what you guys are talking about.
Okay,
You sound kind of crazy.
Here's a hint. It's a disorder of some sort.
Cushing syndrome?
Just take some sort of educated guess. Please.
I don't know, the only thing that's coming to my mind is things that have to do with marijuana.
Yeah. I know. Alright.
Thank you.
Okay. This might take a while to settle it down. Oh, I think
Teacher, Miss Gunnison, do you know what Cushing's syndrome is?
Yeah, it's buffalo hump, moon face, the works.
Wow. Where you got that information?
The symptoms of Cushing's syndrome vary, but most people have upper body obesity, particularly in the face, known as moon face, or between the shoulders, known as buffalo hump. The skin becomes fragile and thin, bruising easily and healing poorly. Purplish pink stretch marks are common. Bones are also weakened, making routine activities such as getting out of a chair a liability.
Moreover, high blood pressure and high blood sugar are common. Men have decreased fertility, and women have excessive hair growth. Finally, there are mental effects as well. Irritability, anxiety, depression, and a reduced libido are all common symptoms.
Sometimes Cushing's is caused by long-term use of corticosteroid medications used to treat asthma, arthritis, and other conditions.
Patients can be weaned off of these medications to keep Cushing's symptoms in check. The cause of Cushing's syndrome is a tumor. Complete surgical removal of the tumor may be necessary. Operating through the nose, surgeons can remove the tumor and decrease cortisol production, thus easing the symptoms of Cushing's. Surgical removal typically costs $20,000 to $40,000. Therapy is also an option, sometimes in conjunction with surgery. Radiation therapy targets the problematic tumor and uses high-energy radiation to kill tumor cells by damaging the DNA. Radiation therapy can cost anywhere from $12,000 to $55,000.
Medications can be used when surgery and radiation don't work. Furthermore, doctors prescribe drug therapy before surgery to improve symptoms and minimize surgical risk. These drugs work by slowing down cortisol production in one's body. Medications cost around $200 through $600 monthly.
Finally, if none of these treatments are effective, a doctor may recommend surgical removal of one's adrenal glands. This procedure will cure excess production of cortisol, but has lasting adverse effects.
Do you find yourself chronically depressed or anxious?
Do you have a moon face, a buffalo hump?
If you answered yes to any or all of these questions, you may have Cushing syndrome. But don't fret, there's a drug on the market that can help people like you. Metropone.
Metropone is used to test if your pituitary gland is sending the proper signals to your adrenal glands, which produce a substance called cortisol.
Take this medication with milk or a snack in accordance with your doctor's directions.
Side effects may include, but are not limited to, nausea, upset stomach, headache, dizziness, or drowsiness.
Do not drive or use machinery while on this medication.